Okay, so get this. Over 6 million Botox treatments are happening every year around the world.
It's incredible, isn't it?
Botox is officially the king or queen of non-surgical cosmetic procedures.
It really is.
And today we're going deep. Specifically on the Botox brow lift, we've got some seriously in-depth medical research to guide us.
Yeah, and we'll unpack it all, the science, the art behind it, everything.
Exactly, because it's more than just getting rid of a few wrinkles, right?
Right.
So how does it work, this brow lift magic?
Well, the research talks about like a muscle tug of war happening in our foreheads.
A tug of war, huh?
Yeah, so picture your eyebrows like, I don't know, a prime piece of real estate.
Okay, I'm picturing it.
So you have the frontalis muscle, that's the one that lifts your brows.
Okay.
But it's got some tough competition.
Oh, the villains of the brow world.
Yeah, you could say that.
Who are they?
You've got the orbicularis oculi, that's the muscle that circles your eye. And then there's the globular complex, the muscles between the brows, the ones that give you frown lines.
Yeah.
They're all pulling your eyebrows down.
So it's like a constant battle.
Exactly. And that's where Botox comes in as like the peacemaker.
Okay, interesting.
So in a Botox brow lift, you're strategically targeting those downward pulling muscles, relaxing them just enough to let the frontalis, that lifting muscle, take charge.
Oh, I see.
It's like, imagine you're in a tug of war and you suddenly release the tension on one side of the rope.
Right. The other side has the advantage.
Exactly.
That makes total sense. But I can see how important the injector's expertise would be.
Oh, absolutely.
They need to be super precise, right?
Yeah, it's not about freezing those muscles completely. The goal is a natural lift. That's why it's so important to go to someone who's qualified, a board-certified dermatologist or a plastic surgeon. They know the anatomy inside and out.
Yeah, this isn't the time to skimp and go for the cheapest deal. I had a friend who did that and ended up with one brow higher than the other for weeks.
Oh, no.
It was not a good look.
Yeah, that's exactly why those guidelines from, organizations like the BAAPS, AD, all of those, they stress that you need a really experienced injector, especially for something like a brow lift.
Because it's not what Botox was originally approved for, right? It's like off-label.
Yeah, you could say that.
So what does that mean exactly?
Well, it's definitely accepted and widely practiced in the medical world, but it is technically outside the FDA's initial approval.
Interesting.
And that's another reason to really make sure you've got a knowledgeable injector, someone who knows the ins and outs.
Okay, so you've found your expert and you're ready for that brow lift. What happens next?
Well, before any needles come out, there's a really important step.
Which is?
A proper assessment. They'll analyze your face, see how your muscles move, talk about what you're hoping to achieve.
So it's personalized.
Exactly. It's not a one-size-fits-all kind of thing.
Like a tailored suit, but for your brows.
I like that. They might inject in the globular complex, that area between the brows, to relax the muscles pulling down on the inner part of the brow.
Got it. So what about that outer part of the brow that can droop and make you look tired? Can Botox help there too?
Absolutely. A tiny bit of Botox might be injected into the orbicularis oculi, that muscle around your eye, near the outer edge of the eyebrow to lift the tail.
Interesting.
They might even use a tiny bit in the frontalis itself, but they have to be very careful.
Why so careful with the frontalis? I thought that was the good guy muscle, the one doing the lifting.
It is, but if you put too much Botox in there, you can end up with that surprised look.
Oh, the spocking.
Yeah, exactly. And we want to avoid that. We're going for subtle, natural-looking results.
Right. Nobody wants to look permanently surprised. So you've had the consultation, you've had the Botox brow lift. What kind of results can you expect?
Well, don't expect a complete overnight transformation. Botox brow lifts are subtle.
Okay, so it's more about enhancing what you already have. And how long does this lift typically last?
Usually around 3 to 4 months, but it really depends.
On what?
Your metabolism, your lifestyle, and even how the Botox was injected can all affect how long it lasts.
Metabolism. My Botox always seems to disappear faster than everyone else's.
Yeah, that happens. It's just one of those individual factors. Some people see results for longer, some shorter.
So, no magic number. Okay, we've talked about all the good stuff, the lift, the refreshed look, but let's be real.
Yeah.
There are risks and side effects.
Yeah, you're right. It's important to be honest about that. Nothing's completely risk-free.
So what are some of those common temporary side effects?
The most common ones are pretty mild, like little bruising, some swelling maybe, a bit of redness at the injection sites. That usually goes away in a few days.
Okay, so not too bad. Anything more serious we should be aware of?
Yeah, there are a few things, but they're less common, especially with an experienced injector.
Like what?
Well, there's something called brow ptosis. It's a drooping of the eyebrow or even the eyelid.
That doesn't sound good.
No, it's not ideal. It happens when the Botox moves around or if it's injected into the wrong muscle. For example, if they put too much Botox in the frontalis, it can weaken the muscle too much and the brow droops instead of lifting.
So again, the injector's skill really matters.
Big time. The good news is, even if brow ptosis happens, it's usually temporary. As the Botox wears off, things go back to normal.
That's a relief. Any other complications to watch out for?
Well, we talked about that Spock look before, that overly arched brow.
Yeah.
That can happen if those muscles that pull the brow down aren't treated properly. Then the frontalis overcompensates.
So you need that muscle balance.
Exactly. And the good thing is, a lot of these complications, if they do happen, can be fixed. An experienced injector can usually make adjustments with a small dose of Botox, to even things out, soften an overly arched brow.
So it's not a one-and-done procedure, it sounds like. You need those checkups and maybe some tweaking.
That's a good way to put it. So we've talked about how Botox brow lifts work, finding the right person to do it, but let's compare it to a surgical brow lift for a second.
Right, because surgery is an option too.
It is.
There's a good comparison chart in the research we have.
Yeah.
First up, longevity. We know Botox is temporary. But a surgical brow lift, that's considered permanent, like 10 years or more.
Right.
Wow, that's a big difference in terms of commitment. What about downtime? How long are you out of commission?
With Botox, you can pretty much go about your day as usual. Surgery, you're looking at 1 to 2 weeks of recovery time.
That's significant.
Yeah. And then there's the cost, of course.
Big factor.
Botox is way less expensive. We're talking hundreds versus thousands of pounds.
That's a big difference. The last thing they compare is reversibility.
Yeah.
Botox, it's totally reversible. Eventually, it just wears off. But a surgical lift is permanent. There's no going back.
Right. So surgery is a much bigger decision.
So how do you decide which path is right for you?
That's where that consultation comes in. Talking to a qualified professional. They can explain the pros and cons of each option and consider what you're hoping to achieve, your budget, how you feel about surgery.
Makes sense. So let's say you're leaning towards the Botox brow lift. What makes a good candidate?
Well, the ideal candidate is someone with mild to moderate brow drooping from aging, not someone whose brows are super droopy.
So if it's really bad, surgery might be a better option.
Exactly. They're also looking for people who want a subtle enhancement, not a drastic change.
Okay, so if you're looking for a dramatic transformation, Botox might not be the way to go.
Right. And of course, good candidates are people who don't want surgery or prefer something less invasive.
Right. It's a great option, but it's not for everyone.
Exactly.
So who should avoid a Botox brow lift, besides those with severe drooping?
Well, as we said, those needing surgery aren't good candidates. Also, people who already have some facial asymmetry, Botox could make that worse.
So it's important to be upfront about any existing conditions.
Absolutely. Honesty is key. That way everyone's on the same page and you get the best and safest outcome. And of course, there are certain medical conditions like neuromuscular disorders where you can't use Botox.
Right. So it's not just about looks, it's about overall health.
Exactly. And the usual precautions like pregnant or breastfeeding women should avoid it too.
Of course. So let's say you are a good candidate. What can you expect at that initial consultation?
The consultation is really important. It's a two-way street. You get to know each other, talk openly about what you want and what you're hoping for.
So it's not just them evaluating you, you're evaluating them too.
Right. You need to feel comfortable and confident with them. It's your face.
That makes sense. So what else happens?
The injector will ask about your medical history, any other aesthetic treatments you've had, allergies, medications, any health conditions you have.
Okay, so it's really thorough.
Yeah, it's all about making sure the treatment is safe and right for you. They'll look at your facial structure, see how your muscles are working, check your skin.
So they can come up with the best plan for you.
Exactly. And most importantly, they'll discuss the risks and benefits, answer any questions you have, and talk about expectations.
What do you mean by manage expectations?
Well, Botox is amazing, but it's not a miracle worker. It can't turn back the clock 20 years.
Right.
It's about enhancing your natural beauty, not transforming you into someone else entirely.
That makes sense. Working with what you have, getting a fresher version of yourself. And speaking of fresh, let's talk about the future of Botox brow lifts.
Oh, yeah. The field is constantly changing. There are always new techniques and innovations popping up.
It's exciting.
The research talked about some really cool advancements, like they're working on Botox that lasts longer. They're doing clinical trials right now.
Wait, so Botox that lasts even longer than 3 to 4 months?
That's the goal. It could last up to 6 months, maybe even longer.
Wow, that would be incredible. Can you imagine only needing a brow lift twice a year?
It would be a game changer for a lot of people. More convenient, maybe even less expensive in the long run.
Right. Fewer treatments, fewer visits to the clinic.
Exactly. But of course, safety is always the top priority. Any new formula has to go through rigorous testing before it's available.
Of course. What about micro Botox? I think you mentioned that earlier, using super tiny doses.
Yeah, it's also called baby Botox. It's all about subtlety. We use very diluted Botox and inject it into very specific muscles.
So it's like a more refined approach.
Exactly. It's great for those delicate areas like the forehead and around the eyes where you want a softer look.
Makes sense. Good for people new to Botox or those who are a bit hesitant.
Right. A good way to try it out without a big change.
So let's talk about combination therapies. You mentioned combining Botox with things like thread lifts and fillers. How do those work together?
Well, when we age, lots of things happen. We lose volume, our skin loses its elasticity, muscles start to sag.
Not fun.
Right. And all of that makes us look older. So to really tackle these things, we often use a few different treatments together.
I see. So it's about taking a more comprehensive approach, looking at the whole picture.
Exactly. Say you're dealing with brow descent. You've lost some volume in your temples, and you have some fine lines around your eyes. We might use Botox to lift the brows, then a hyaluronic acid filler to plump up the temples, and maybe even a laser treatment or a peel for those fine lines.
So it's like mixing a custom cocktail for your face.
I love that analogy. And by combining treatments, you get a more harmonious, natural look because you're treating all the different parts of the aging process.
It's about aging gracefully, addressing everything.
Yeah.
And I have to ask more about AI-guided injection mapping.
It's so cool, isn't it?
It still sounds so futuristic to me. How does it work?
So there are companies developing this amazing software that uses AI to create personalized injection maps.
So the computer tells the injector exactly where to inject.
Pretty much. The software analyzes your face, your muscles, and what you're hoping to achieve to make a super precise injection plan.
That's incredible. So walk me through how that works in a consultation.
They take high-resolution photos of your face. Those photos are uploaded to the software, which creates a 3D model of your face.
Oh, wow. So it's like a digital twin.
Exactly. And that allows the software to map out the muscles, blood vessels, and nerves to find the best spots to inject.
That makes so much sense. It takes away all the guesswork.
Right. Precision and predictability, that's what it's all about. And by doing that, you can get better results with less product, which can save you money and reduce the risk of side effects.
This AI technology is going to completely change how we do these treatments.
I think so. It's really exciting to see what they come up with next.
It really is.
Yeah.
But with all this technology, we also have to think about the ethical side of things, right?
Oh, absolutely. Botox and other aesthetic treatments offer amazing benefits, but it's important to use them responsibly.
So what are some of those ethical considerations when it comes to Botox brow lifts?
One of the most important is informed consent. Patients need to understand the procedure, the risks, the benefits, the alternative.
So it's not just about signing a form, it's about a real conversation.
Yes. Open communication, making sure the patient feels empowered to make their own decision.
Right. That's where the consultation is so crucial.
Exactly. And the injector has to be honest and realistic about what Botox can do. No over-promising or setting unrealistic expectations.
Right. What else?
Another important one is the psychological well-being of the patient. The injector needs to be sensitive to why someone wants treatment. Make sure their motivations are healthy.
So you have to look deeper, consider their emotional side of things.
Exactly. Like if someone's doing it just to please someone else or because they feel pressured by society, we need to talk about that.
It's about helping them feel good about themselves in a healthy way.
Right. And if someone seems to have body image issues, we need to refer them to a mental health professional.
Right. Sometimes you need a different kind of help.
Absolutely. And this leads to another important ethical point, avoiding over-treatment.
What does that mean?
It means not pushing treatments on people who don't need them or who wouldn't benefit from them.
Right. So it's about being responsible, putting their needs first.
Yes, even if it means you might lose a client, you have to act with integrity.
It's about building trust, not just treating people like transactions.
Exactly. And that can be hard in the aesthetics world where there's pressure to sell, to meet targets.
It can be a slippery slope, but in the end, the patient's safety and well-being are paramount.
Absolutely.
So we've talked about informed consent, realistic expectations, psychological well-being, and avoiding over-treatment. Anything else?
One more, cultural sensitivity.
What does that involve?
It's about understanding that beauty standards are different in different cultures and respecting those differences.
So not imposing one ideal on everyone.
Right. It's about celebrating the diversity of beauty and helping people reach their own goals, not trying to fit them into a mold.
Because beauty isn't one size fits all.
Exactly. And that's where the artistry of aesthetics comes in. Understanding different facial features and using treatments to enhance those unique characteristics.
Like you're an artist, but instead of paint and a canvas, you're using Botox and fillers.
I like that. It's about combining the science with the artistry.
It sounds like the future of Botox brow lifts. And actually, all aesthetics depends on both technology and ethical awareness.
I think you're absolutely right. And as these treatments become more and more popular, it's even more important to be responsible and ethical.
It's about empowering people, not exploiting them.
Exactly. And that's why it's so important to talk about these things, ethics, diversity, informed consent. We need to keep having these conversations.
I agree. So we've covered a lot about Botox brow lifts. The science, the art, the ethics, the future. But in the end, deciding whether or not to have one is a personal choice.
It is.
And it's a decision you should make carefully after doing your research and talking to a qualified professional.
I agree.
So do your homework, ask lots of questions, and explore all your options. And most importantly, do what makes you feel good, what makes you feel confident.
Well said.
Thanks for joining us for this deep dive into Botox brow lifts. We'll be back soon with another episode exploring the world of health and beauty. Until then, keep learning, keep exploring.
See you next time. It's amazing how this idea of personalized beauty, it kind of goes back to that crazy stat we started with 6 million Botox treatments every year. It really shows how much people want these treatments, but they want them to be tailored to their needs.
Yeah, it's not about everyone looking the same anymore. It's about finding what works for you. Like we were saying, subtle tweaks, not huge transformations.
Exactly. And the Botox brow lift is a great example of that. A little refresh, a little rejuvenation.
Yeah, looking like you, but like the best version of you.
Right, exactly. And this whole personalized beauty thing, it's only getting bigger, especially with all these new technologies coming out.
Speaking of which, I'm still thinking about those advancements we were talking about. Longer lasting Botox, micro Botox, those combination therapies, the AI stuff. Mind blowing.
I know, right? It's a really exciting time to be in this field.
Okay, so tell me more about that longer lasting Botox. How does that even work?
Well, they're doing all sorts of things like modifying the Botox molecule itself to make it last longer.
Oh, wow.
Some of them are attaching it to a protein or putting it in a slow release capsule.
So it's like time release Botox.
Yeah, exactly. That way it's released gradually and lasts longer.
Hey, imagine if you only had to get a brow lift twice a year.
Right. It would be amazing. And it could even end up being cheaper over time because you'd need fewer treatments.
That's true. Fewer trips to the clinic.
Yeah.
But I'm sure there's lots of testing to be done before that happens.
Oh, yeah. Tons. Safety first, always. So you mentioned micro-Botox, too.
Yeah, the baby Botox. You said it's all about using really small doses for a more natural look.
Right. We use tiny drops of very diluted Botox, and we target very specific muscles.
So it's all about being precise.
Exactly. It minimizes those side effects we talked about, that frozen look.
Yeah.
It's really good for around the eyes and forehead.
Perfect for people who want a subtle change.
Exactly. And then there are the combination therapies, like combining Botox with thread lifts or fillers.
Right. Tell me more about those. Why are they so effective?
Well, think about what happens as we age.
Oh, why they're not.
Haha, fair enough. But we lose volume, our skin gets less elastic, things start to sag.
Like a triple threat of aging.
You got it. And each of those things contributes to looking older. So to get the best results, we often use a few different treatments together.
So you're addressing everything at once.
Yeah, for example, you might have some brow drooping and then some volume loss in your temples, maybe some fine lines around your eyes.
Sounds about right.
In that case, we might use Botox for the brows, then a filler for the temples, maybe a laser or a peel for the lines.
It's like a custom blend of anti-aging treatments.
Exactly. That way we're treating all the different aspects of aging.
A multi-pronged approach. I like it. Okay, I got to know more about the AI injection mapping. It's just so fascinating to me.
It is pretty amazing.
Yeah.
These companies are using AI to create personalized injection maps for Botox and fillers.
It's like the computer knows your face better than you do.
Almost. It analyzes everything, your anatomy, your muscle movements, even your goals, to come up with the best plan.
So how does that actually work in a consultation?
They take pictures of your face with a special camera,
Okay.
and they upload those pictures to the software, which then creates a 3D model of your face.
So they basically have a digital copy of your face.
Yep. And that lets them map out all the muscles, the blood vessels, the nerves to find the absolute best places to inject.
That's insane. So precise.
Exactly. And that means you can often get better results with less product, which can save you money and reduce side effects.
This AI stuff is going to revolutionize the whole industry.
I think so. It's a really exciting time.
It really is. But of course, we can't forget about the ethical side of things.
Oh, of course not. It's so important to use these treatments responsibly.
So let's talk about that. What are some of the ethical things we need to consider with Botox brow lifts?
Well, informed consent is a big one. Patients need to know everything. The procedure, the risks, the benefits, the alternatives.
So it's more than just signing on the dotted line.
Yeah, it's about having a real conversation, making sure they understand everything and feel comfortable.
Right. And being honest about what Botox can and can't do.
Absolutely. No false promises. And we also need to think about the patient's mental well-being. Why do they want this treatment? Are they doing it for the right reasons?
Right. You have to think about their motivations.
Exactly. Like if they're just trying to please someone else or if they feel pressured by society, we need to talk about that.
It's about helping them feel good about themselves, not feeding into any insecurities.
Right. And if they have any body image issues, we might need to refer them to a therapist. Sometimes that's more important than any cosmetic treatment.
Absolutely.
Yeah.
And then there's the issue of overtreatment.
Yeah, that's a big one. It's so easy to get caught up in trying to sell more treatments, but we have to remember that not everyone needs them.
It's about putting the patient first, not your profits.
Exactly. It can be a tough balance, but it's so important.
Okay, so we've got informed consent, realistic expectations, the patient's mental well-being, and avoiding overtreatment. Anything else?
Oh, one more thing, cultural sensitivity. Beauty standards are different all over the world.
Right. What's beautiful in one culture might not be in another.
Exactly. So we have to be respectful of that. We shouldn't be trying to make everyone look the same.
That's so important. We need to celebrate diversity.
And that's part of what makes this field so interesting, It's about understanding different facial features and using treatments to enhance those unique characteristics. It's almost like art.
Yeah, you're like a sculptor, but instead of clay, you're working with people's faces.
That's a great way to put it.
So it sounds like the future of Botox brow lifts, and really all aesthetics, is about finding that balance between technology and ethics.
I think so. We have these amazing tools, but we have to use them wisely.
Absolutely.
Yeah.
We have to use them to empower people, not to exploit them.
Exactly. And that's why these conversations are so important. We need to keep talking about these things, keep learning, keep growing.
Well said. Okay, so we've talked a lot about Botox brow lifts. But in the end, it all comes down to that number we started with. 6 million treatments a year.
It's pretty mind-blowing, isn't it?
It is. What do you think it says about the way we view beauty today?
I think it shows that we're moving away from this idea that there's only one way to be beautiful. People are starting to embrace their individuality.
And they're looking for ways to enhance their natural beauty, not erase it completely.
Exactly. It's a much more nuanced and personalized approach. And I think that's a good thing.
I agree. It's about being the best version of yourself, whatever that means to you.
Absolutely. And I think the future of beauty is all about embracing diversity, promoting self-acceptance, and using these tools in a safe and responsible way.
I love that. Thinking back to when Botox first got big, it was all about erasing wrinkles, right?
It was like this quest for the perfectly smooth face.
Yeah. But now it feels like the trend is shifting.
Definitely. People want to look natural, let their faces show their personality.
Yeah, it's not about getting rid of every line. It's about enhancing what you have.
And that's where you really see the injector's skill. Less is more. It's those little tweaks, not trying to change everything.
Finding that balance, looking refreshed, but still like yourself.
Exactly. I think this focus on individual beauty is a really good thing.
I agree. It's about accepting aging and just, looking your best at any age.
Absolutely. So as we wrap up this deep dive into the Botox brow lift, it all comes down to this: the decision to have one is personal.
It is. And there's a lot to consider, right?
Definitely.
We've talked about so much today: the science, the techniques, the ethics, the future of it all.
It's a lot to take in.
It is. But ultimately, you have to do your research, talk to an expert, and make the decision that's best for you.
Absolutely.
So to our listeners, do your homework, ask those questions, and most importantly, feel confident in your choices.
Great advice.
Thanks for joining us on this journey into the world of Botox brow lifts. We'll be back soon with more deep dives into all things health and beauty.
See you then.